We continue with treatment principles, root and manifestation. When considering the root and manifestation, it is important to understand the connection between the two. They are not separate entities, but two aspects of a contradiction, like yin and yang. As their name suggests, they are related to one another, just as the roots of a tree are connected to its branches. The former under the ground and invisible, the latter above the ground and visible. The same relation exists between the root of a disease and its clinical manifestations. They are indissolubly related and they form two aspects of the same entity. There is no separation between the two. For this reason, it is not entirely correct to translate pen as cause, since the relation between the root and manifestation is not a causal one. The root is not the cause of the branches, but the two together form the entity of a tree. The art of diagnosis consists precisely in identifying the root, that is, the root of symptoms and signs, by looking at the manifestation, that is, the clinical manifestations. For example, if a person has diarrhea, chilliness, tiredness, poor appetite, abdominal distension, a weak pulse, and a pale tongue, the complex of these clinical manifestations clearly points to its root, that is, spleen-yang deficiency. In this simple example, therefore, spleen-yang deficiency is the root, and all the symptoms and signs are the manifestation of the disease. It is only when we master the art of pattern identification that we can identify the root by looking at the pattern woven by the manifestation, much like a botanist can identify a tree by looking at its leaves. To give an example of original and deriving pattern as root and manifestation, spleen-2 deficiency may be the original pattern or root, and dampness the deriving pattern manifestation. In endometriosis, often a deficiency of kidney yang is the root, while blood stasis is the manifestation. Please note that clinical situations may be very complicated, as a manifestation may in turn become a root. In the example given, kidney yang deficiency, the root may give rise to blood stasis, the manifestation, and this in turn may cause dryness, a manifestation. So here we have the schema of a manifestation becoming the secondary root. So from kidney yang deficiency to blood stasis, which will eventually lead to dryness. Thank you for your attention.